Cranial somatic dysfunction diagnosis. In order to diagnose dysfunctions of the cranium, there are 3 basic handholds. And what we want to do is to review those handholds to see if we could get a sense of what's going on with the cranium and if we see any asymmetries or feel any sort of pulls as we're in those positions. So what we want to do first is to get our hands in a vault hold. The vault hold is the most basic hold here. What we want to do is to get our hands on the vault to get a sense of what might be going on at the base. So we're going to place our pointer finger over the greater wing. Our 3rd and 4th fingers are going to straddle the ear, one in front of the ear and one behind the ear. And our pinky finger is going to come back and try to reach the occiput. And we're going to do the same thing with the opposite hand. We're going to get our thumbs touching but not pushing down on the head. And we want to have a nice gentle contact. We don't want to squeeze on the head. And now we want to get a sense of what might be going on underneath our fingers. Do we feel a symmetry? Do we feel a flexion and extension? Do we feel things kind of expanding and contracting? And in this hold, you could appreciate what's going on at the vault to try to get a sense of a diagnosis at the cranial base. Another hold that we could utilize is the frontal occipital hold. So in the frontal occipital hold, we're going to get an AP contact. We're going to place our hands underneath the occiput. And so one hand is across with our fingers along the nuchal line, and the other hand is going to rest on the frontal bone with my middle finger on glabella and my 2nd and 4th fingers also on the frontal bone. So in this contact, we get a better sense of the anterior posterior cranium, and we could see what we're feeling. And it's almost like getting another view of the cranium so that you could get a sense of what's going on at the base. There is the posterior occipital hold, or also the Becker hold. In this hold, we're focusing a little bit more at the posterior fossa here. We're going to let our palms rest on the occiput. The rest of our fingers could kind of rest gently on the cervical spine. And we're going to let the weight of the head just kind of rest on our palms. And our thumbs are going to come forward and reach the greater wings of the sphenoid. So with this contact, we're getting a better sense of what's going on in the posterior aspect of the cranium with a little bit more of a focus on the occiput, the temporal bones, and my thumbs up here reaching forward to the sphenoid. So through these 3 hand contacts, we can get a better sense of what's going on at the cranium. So with our holds, we're trying to get a sense of cranial strain patterns. The cranial strain patterns are an adaptation of the cranium at the vault for what's going on at the base. So the first contact that we had, the vault hold, is what we're going to use. And with the vault hold, what we're going to get a sense of are different strain patterns that are accommodations at the base. There are 3 strain patterns that are physiologic. They are flexion and extension, side bending and rotation, and torsions. So the first physiologic one we'll talk about is flexion and extension. We get our fingers in a vault hold, and what you're going to get a sense of is with flexion, your fingers are going to spread out a little more and kind of move down towards the feet. And then with extension, your fingers are going to come closer together and come up to the head. So again, flexion and a little bit wider, and extension, a little bit more narrow, and your fingers coming up towards the head. The next pattern we're going to look at is side bending rotation. Remember, side bending rotation, we're going to have our fingers spread out on one side. That's the side of convexity, and then go down and rotate on that AP axis down towards the feet. So here is a right side bending rotation. My fingers are going to spread out on the right hand and rotate down towards the feet. While the opposite hand is my fingers are going to come closer together and rotate up towards the head. So that would be a right side bending rotation. A left side bending rotation, my fingers are going to spread out on the left side, and my fingers are going to come closer together on the right side, and my fingers on the left hand are going to go down towards the feet, and my fingers on the right hand are going to go up towards the head. So this would be the vault hold, and this would be a left side bending rotation. So once again, a right side bending rotation and a left side bending rotation. The third physiologic strain pattern is a torsion. So remember, the torsions, the sphenoid and occiput are rotating in opposite directions on the AP axis. So what you're going to feel is the greater wing is going to come up along with the rest of the cranium on one side. So this would be a right torsion. And then this would be a left torsion. Your hands are going to kind of go in opposite directions in torsion. So right torsion and a left torsion. So those are the three physiologic strain patterns. The non-physiologic strain patterns tend to be secondary to traumas. We have our lateral strains and our superior and inferior shears and compressions. So lateral strain patterns, what you have happening is the sphenoid and occiput are rotating in the same direction on two vertical axes, and what you're going to get is the sphenoid and occiput are going to shift on each other and shear. So this would be a lateral shear with the greater wing to the right, and this would be a lateral shear with the greater wing to the left. It's almost making a parallelogram with your hands. So again, vault hold, and this is a lateral shear with the greater wing to the right, and here's a lateral strain, greater wing to the left. In superior and inferior shears, you have your sphenoid and occiput rotating in the same direction about two transverse axes. So what happens is the sphenoid is going to rotate anteriorly into extension, and the occiput is also going to rotate into extension, and what you have, the occiput is going to rotate into flexion, and so what you have is all your fingers are going to feel like they're going down. So in a superior shear, from a vault hold, all your fingers are going to feel like they're going to point down towards the table. In an inferior shear, the sphenoid is going to rotate posteriorly, and the occiput is also going to rotate posteriorly, so everything's going to feel like they're going up towards the ceiling. So in a inferior shear, all your fingers are going to kind of rotate up towards the ceiling, and in a superior shear, all your fingers are going to rotate down towards the floor. Finally, in a SBS compression, what you're going to get a sense of is as you put your hands in a vault hold, that you really don't feel much excursion at all. You really can't detect much expansion. The traumatic forces of a SBS compression has pushed the sphenoid and occiput and compressed at the SBS, that there's really a lack of general motion or movement or excursion, and you might feel an increased density. So those are our three non-physiologic strain patterns.